How shocked would you be if I told you one of the secrets to extending your health and longevity lies in your mouth? Not so shocked. Huh. Well, what if I added it has nothing to do with eating? Yeah, now I got your attention. And a new talk track for dentists everywhere. Because, come on, flossing and brushing was getting kind of dull. Yo, what is up? Welcome back to another week of How to Health. My name is Kevin. I run liftandbalance.com, where we take aim at all things health and longevity and do it in an odd, weird, interesting, and highly sarcastic way. Today, we will be discussing the little known and spoken about link between the status of our mouth and the health of our pretty cool meat suit. Both here and now and over time. Because deep within the confines of our chompers, gums, and oral cavity lie a number of critical health modulating factors that have systemic reach throughout the entire body. So, we're going to disguise ourselves as our morning coffee and go explore. Specifically, what they are, how they influence disease over time, and most importantly, how you can shore up your oral health, and thus your odds, likelihood, and probability of longevity. Oh, and enlighten your dentist on how important and profound their job really is, which will make them just feel super swell inside. But in order to do that, we must first explore if the data really lines up with the hype. And what better way to start than with the little spoken about ecosystem that thrives in and around our teeth, tongue, and gums. The microbe world within our mouth. One of the key points that we keep on reiterating through all of the microbiome videos on this channel is the fact that our microbes are not solely confined to our gut. They're everywhere, including on our skin, which we discuss here, and in our mouth, influencing our biological function from all these distinct locations in different ways, reaching their tentacles of wisdom far and wide. But as we also know, these microbes are a byproduct of their environment, having the power to wield both a health-boosting and health-deteriorating effect depending on the circumstance, essentially making you a microbe farmer in a way, cultivating their environments with food, nature, exercise, and sleep, along with all the other things you put in and on your body, ultimately modulating the communities which prosper and affect you, their host. That being said, one place no microbes belong is within the confines of the hottest biological club in town, club circulation. Because if and when they get in, the byproducts are often inflammation and cellular dysfunction, a combo which is on nobody's longevity checklist. And guess what? A neglected oral cavity happens to be one of those places that microbes can sneak on in. But before we get there, let's quickly highlight some of the key benefits of having microbes in our mouth in the first place. Because I gotta say, they have quite the interesting resume. This community of microorganisms, which call our oral cavity their home, help protect your gums and teeth from disease, regulate the immune system, prevent infection, produce vitamins and other nutrients such as vitamin K and folate, while even influencing mood and cognitive function. One way being through the secretion of compounds such as short-chain fatty acids, which have an anti-inflammatory effect in the brain. Not bad, if you ask me. I guess these microbes aren't just a bunch of oral derelicts. That being said, these outcomes are when the communities of microbes in your mouth have been cultivated by you to be beneficial. And if you want to know the truth, the modern day base case is quite the opposite. A situation of oral microbe dysfunction and dysbiosis driven by modern day societal norms that bring out the worst of our biological wiring, ultimately creating a scarcely diverse yet quite hostile ecosystem which impair the natural processes of the mouth, increase the formation of plaques, damage the gums, drive the creation of gaps between the gums and the teeth, and ultimately open up a pathway for things to get into club circulation that are not supposed to. And if you're looking for a name to this scenario that we just laid out on the tube-of-ube table, it's a growing condition called periodontal disease, a very real happening which emerging research suggests has serious implications on disease risk and thus longevity risk throughout the body, including associations to some of the top diseases plaguing modern society, like cardiovascular disease, high blood pressure, and autoimmune conditions. Let's take a deeper look at the data. Research to date has implicated the microbes in our mouth as a main modulator of downstream oral diseases such as gingivitis, tooth decay, and periodontal disease. And here's how it typically goes down. As we eat, food interacts with the microbes in our mouth and forms plaques, which is a sticky film of food, saliva, and bacteria which form on our teeth. If this sticky film of plaque is left unattended, it can build, irritate gums, cause them to become inflamed, and eventually lead to a chronic infection, eventually causing gums to recede and teeth to become loose, opening up the doors for systemic health issues to arise. One of which is the higher prevalence of the #1 chronic killer on the planet, heart disease, as several studies have now found an association, hypothesizing that an increase of bacteria entering the bloodstream from the mouth may induce an inflammatory response and thus the risk for heart damage and arterial plaquing. But here's the thing. If an individual's lifestyle is promoting periodontal disease, it's likely already increasing one's odds for cardiovascular disease independently, a combination which likely only multiplies an already increased risk of cardiovascular disease and accelerates the process. Next, we have high blood pressure. Research has shown that people who have periodontal disease have lower levels of nitric oxide in their saliva compared to people who have healthy gums. This is a compound which stimulates blood vessels to relax, improving blood flow and as a byproduct reducing blood pressure. And dysfunction in the oral cavity is hypothesized to impact nitric oxide production in a few potential ways. One, in which the suboptimal communities of microbes directly interfere with its production, or another where microbes supporting nitric oxide production get wiped out by something like an antiseptic mouthwash. Certainly makes you think. Next, we move to the complex world of autoimmune diseases, which are unfortunately impacting a greater proportion of the population each year. A new 2023 study published in the journal Scientific Translation found that mucosal breaks in the mouth may be a potential trigger for rheumatoid arthritis. These are small tears or ulcers in the lining of the mouth that potentially provide an entry point into club circulation. The study found that rheumatoid arthritis patients were more likely to have oral mucosal breaks than healthy controls, and that the RA patients with oral mucosal breaks were also more likely to have bacteria particles that can be traced back to their oral microbiome present in the bloodstream during time of flare-ups, helping us conclude once again that no system which operates in the pretty cool meat suit we call our body acts in isolation. Everything is connected, and thus all health and dysfunction is connected. Now, we must keep in mind that this exploration into the oral cavity for its health and longevity modulating effects is still in its infancy, with only associations being identified rather than causal effects. But all of this is still nonetheless super interesting, and makes a convincing case that investing in the health of our chompers and the surrounding area is a pretty good idea. So, let's explore some ways to do just that. And yes, this will go a tad deeper than just brushing and flossing. Although, I gotta ask, have you flossed today? Just a thought. As you know already, there are a number of mainstream ways to keep your oral health in check. But you gotta ask, are they also keeping your oral ecosystem healthy, functional, and vibrant? Truth is, many of these mainstream ways actually push the narrative of destroying bacteria in the mouth, rather than cultivating a healthy, vibrant ecosystem which allows them to thrive. And as a byproduct, allows you to thrive. Because now we know when the beneficial communities of microbes are thriving, more often than not, we are too. And despite what 4 out of 5 dentists may recommend, this thriving doesn't start with brushing and flossing, but instead what we eat, drink, and consume. This is because the food we eat provides nutrients for the bacteria in our mouth and regulates the pH of our saliva. And you may be asking, why is this significant? Because the pH of the saliva is important in modulating what bacteria survive and thrive in our mouth. For example, a diet in high-fat, high-sugar, ultra-processed foods creates an environment for suboptimal communities of bacteria to prosper, constantly producing acids which can damage our teeth and gums. While a real whole food way of eating, including nutrient-dense, fiber-filled options, can help to promote the growth of beneficial communities which secrete compounds that help keep our teeth and gums healthy. And while you're eating this way, having a consistent brushing and flossing routine, especially after that last meal of a day, is a good OG habit to keep on keeping on. This will help reduce plaque buildup, which is at the origin of most oral health conditions, and prevent further downstream damage. Try opting for a natural toothpaste and going fluoride-free, including cutting off the antibacterial mouthwashes and oral products, as all of these can have impacts on the diversity and health of your oral microbiome and affect them in negative ways. And you shouldn't even need them if you're eating healthy, real whole foods. And on the topic of things to limit or stop completely, tobacco products and alcohol should be considered. Both of these impact oral health and function, irritating and damaging the gums, making the mouth dry, and impacting microbe diversity in a negative way. And because it's better not to simply trust the naked eye, scheduling regular trips to the dentist every 6 months or so should become or stay a part of your oral health routine. Here you can get expert cleaning and take advantage of the wonderful world of technology for a deeper analysis of your current chomper health status. Oh, and like I said before, enlighten your dentist on how very important their job is. Because whether you'd like to admit it or not, there's a growing and evident connection between the health and vitality of your mouth and the health and vitality of your body. So when you get a chance, maybe when you're taking a breather, washing out your mouth, give your dentist some props. Better yet, ask them why bacteria in our mouth can be good for us rather than just inherently evil. And if they respond with some wipe out bacteria rhetoric, well, that might tell you all you need to know. Dentistfinder.org, anyone? Just saying. Now get out there and go smile.